Good morning all. My title of presentation is Assessment of Quality of Life in Primary Angle Closure Glaucoma. Angle closure disease accounts for about 50% of blindness due to glaucoma, and the prevalence of primary angle closure glaucoma is 1.58% and that of primary open angle glaucoma is 1.62% in South Indian population. The assessment of quality of life is an important outcome measure in the management of glaucoma. And the main goal of glaucoma management is the preservation of quality of life and visual function of the patient. The tools which are available for the measurement of quality of life are known as patient-reported outcome instruments. And this can be either disease-specific or non-disease specific. The Glaucoma Quality of Life 15 and Viswanathan 10 questionnaires are examples of disease-specific questionnaires. The aim of my study is to compare the two disease-specific questionnaires, that is Glaucoma Quality of Life 15 and Viswanathan 10, in the assessment of quality of life of patients with primary angle closure glaucoma. My study was a hospital-based cross-sectional study done in a tertiary care center in Trivandrum in 125 patients with primary angle closure glaucoma from July 2021 to June 2022. Those patients who are fit into the ISGO definition of primary angle closure glaucoma was selected into the study, and those with a history of acute angle closure attack was excluded from the study, and those patients with a history of other retinal pathologies also excluded, and those with the visually significant cataract also excluded. The standard glaucoma examination was done using these standard instruments. The patients were categorized into mild, moderate and severe glaucoma based on the Hoddap-Parrish-Anderson criteria, considering the visual field defects in the less severely affected eye. And all the patients were administered the two semi-structured validated questionnaires. The Glaucoma Quality of Life 15 had 15 items and 4 domains. Viswanathan 10 has 10 items. This is the Viswanathan 10 questionnaire. It has 10 items. Glaucoma Quality of Life 15 questionnaire has 15 items. The data collected was analyzed using SPSS version 20. ANOVA test was used to compare the quality of life scores across the various severity of glaucoma. Cronbach's alpha measured to assess the internal reliability of the questionnaires, and Pearson correlation coefficient to compare the quality of life scores between the two questionnaires. And about 70.4% of the patients were in the age group of 46 to 60 years. 72.8% of them were females. 60.8% had mild and 24.8% had moderate glaucoma. The Cronbach's alpha of Viswanathan 10 was 0.773 and that of Glaucoma Quality of Life 15 was 0.983. The average time taken to administer the Viswanathan 10 questionnaire was 4 minutes and Glaucoma Quality of Life 15 was 6 minutes. Both of them had a high negative correlation across the total score as well as the various severity of glaucoma. There is a statistically significant difference between mild, moderate and severe glaucoma in both the questionnaires. In case of Viswanathan 10 questionnaire, higher the quality of life score, patient had a better quality of life. In case of Glaucoma Quality of Life 15 questionnaire, higher the quality of life score, patient had a poor quality of life. In my study, most of the patients were females, and the Glaucoma Quality of Life 15 had a high internal consistency and Viswanathan 10 had an acceptable internal consistency. Both of them were able to differentiate between various severity of glaucoma, and both of them correlated well across the total score and across the varying severity of glaucoma. For most of the patients, glare and dark adaptation was problematic. In study by Kumar et al. Done in primary open angle glaucoma patients, almost similar results were found, except that both the questionnaire had a high internal consistency. In Goldberg et al. Study, it was also using the Glaucoma Quality of Life 15 questionnaire. The questionnaire was able to differentiate between various severity of glaucoma. Most of the patients had problem of glare and dark adaptation. Nelson et al. Using the Glaucoma Quality of Life 15 questionnaire was not able to differentiate between various severity of glaucoma. From my study, it is concluded that Glaucoma Quality of Life 15 questionnaire was more useful than Viswanathan 10 questionnaire in assessing the quality of life in patients with primary angle closure glaucoma patients. And both of them were able to differentiate between mild, moderate and severe glaucoma, which suggests its utility in clinical practice. The disadvantage of disease-specific instruments is that they lack general health-related assessment. And use of multiple instruments will be more useful than using a single instrument. More studies are required to develop tools which may be including the side effects and cost of medications, etc. And these are my strengths. I used a glaucoma-specific questionnaire and did a monocular assessment. Limitations are: it is done in a tertiary care center, may not represent the entire population, no binocular data is available. These are my references.
Actually, what is the aim of this study?
To compare these questionnaires in assessing the quality of life of primary angle closure glaucoma patients.
So this Viswanathan questionnaire is found where?
The internal consistency was higher
No,
with...
it has been published where? Because he told Viswanathan, you have compared Viswanathan questionnaire to some other something.
Glaucoma standard.
There was
What is the reference for Viswanathan 10?
sir, it was in study by Suresh et al. The 3 questionnaires were compared in primary open angle glaucoma. That is the National Eye Institute Visual Function Questionnaire, and these two, the Glaucoma Quality of Life 15 questionnaire and Viswanathan 10. That was done in primary open angle glaucoma.
Who is Viswanathan? That's what I want. You don't know.
Where did you get that Viswanathan 10 questionnaire?
From this study by Suresh et al.
In which book, journals?
IJO.
IJO.
Was it a cited
Yes, sir.
paper?
Yes, sir.
High rating? Citation was high rated?
Yes, sir.
Okay, what do you mean by quality of life?
The quality of life means the patient's perspective, how the the process and the medications, the side effects and the cost, all that affect the outcome of the visual and the daily activities of the patient. How it affects in glaucoma.
See, you have excluded acute cases.
Acute cases.
That means you have taken only the
Chronic angle closure glaucoma patients only.
It's going to be similar. How?
Sir?
Chronic angle closure glaucoma or primary open angle glaucoma, the damage is going to be the same in
Same.
this. So then where is the question of comparing? Do you understand the question? Chronic angle closure glaucoma is as good as primary open angle glaucoma. Only thing is the angle is closed.
Okay.
The presentation will be the same in both. Angle closure can progress a little faster than primary open angle glaucoma. Okay, thank you.